Welcome to the Transplant Institute at Methodist Dallas Kidney Transplant Education video series. This video will introduce you to the medical professionals who will be a part of your transplant team. Your journey to kidney transplantation may involve a dialysis center. The staff there who will have the most direct connection to your Transplant Institute at Methodist Dallas transplant team are your dialysis center nephrologist and the center's social worker. Your dialysis nephrologist will be in charge of creating a dialysis program that is suited to your specific needs. They will continually monitor your dialysis needs as you wait for a kidney transplant. The dialysis center social worker will help you complete and submit your transplant application for referral to the Transplant Institute at Methodist Dallas. The first Methodist transplant team member you will be connected with is your Transplant Coordinator. They will be assigned to your case early on and remain with you throughout your care. The Transplant Coordinator will perform a variety of tasks, such as being your go-to resource for questions and concerns, act as the liaison between you and the rest of your transplant team, as well as organizing all elements of your transplant care. A transplant scheduler will be in charge of contacting you or your family to schedule all your appointments, visits, and follow-up care needs as organized by your Transplant Coordinator. In addition to being assigned a transplant coordinator, each patient is assigned a licensed transplant social worker. Your social worker evaluates you during the transplant evaluation and works with you and your family on all insurance matters, financial expectations, identifying financial assistance resources, as well as making sure you have an adequate social support system in place. If needed, a psychologist specializing in transplant care will be added to your team to help with the psychological challenges of your transplant journey. Our dietitians work with you to evaluate your nutritional status and complete frailty testing to determine if you need physical therapy to increase your strength for transplant. Patients meet with a transplant nephrologist during the transplant evaluation process to undergo a medical assessment. If an organ offer is made, it is a transplant nephrologist who performs the advanced health screening at the hospital to approve you for surgery. Most of your post-surgical care will be with your transplant nephrologist. After you are approved and listed, your transplant team will perform your annual health checks, which are required to remain on the transplant waiting list. You will have a consultation with one of our transplant surgeons as part of your transplant evaluation. They will explain your surgical options in great detail and answer any questions you or your family may have. One of our transplant surgeons is always on call to respond to organ offers. After your surgery, your transplant surgeon will visit you to discuss your recovery. Your recovery will take place on the transplant floor of Charles A. Sammons Tower. This floor is dedicated to transplant patients and is staffed by specially trained doctors and nurses. They have undergone extra training in order to provide the unique care that transplant patients require. Thank you for watching. To continue learning more about kidney transplant at Methodist Dallas Medical Center, please view all our education videos.